Come to think of it, should there be corruption in the healthcare? Most of us, when we hear corruption, we think of financial crime. When individuals in the government misappropriate funds, take funds for what they are meant to and divert it into other use or personal use. Even ghost workers, we've heard a lot of cases. Growing up, I can say it's growing up, I've heard a lot of civil servants that are putting ghost workers on the payroll so that they can divert the fund into their personal accounts. Now, let's talk about corruption in healthcare system. When corruption enters the healthcare, it doesn't just hurt the government bank, it takes lives. It hurts babies, mothers, sons, father. I can attest to it. A lot of people have lost loved ones, either father, son, mother, due to quackery or incompetence of healthcare workers. It's not because the healthcare workers are incompetent. They are just underfunded and are unable to do what they are meant to do, to offer quality care. Now, let's talk about Nigeria. Nigeria, I'm a Nigerian, and this is always a dear place to me. Most people that know me, every time I speak about what I can do for Nigeria to be able to help the healthcare system. Different programs are coming into my head. I've applied, submitted proposals to different government parastatals, but still not heard anything back. In the recently submitted budget by the president, Nigeria is spending between 2 to 6% on healthcare. An healthcare system that is currently underfunded, then you are spending that ridiculous number is really low. Then you are forcing people to take money out of their pockets. Most of Nigerians, they earn below the minimum wage in Nigeria, which is 70,000 naira. That is sad. It's not even up to, I don't think it's up to 50 pounds. Or less than $100. And you expect people to leave a country that the inflation rate is through the roof. Then you expect to receive quality care and people to take care of you. That's why a lot of people go to the hospital and they notice in the hospital, doctors, nurses. In fact, let me give you an example. GSU is currently on strike in Nigeria because the government is not meeting our demands. And the members of the union have taken it upon them that they are going to stay at home until their demands are met. This is sad to hear for the everyday person. Mr. President can easily jump on a plane and fly to a foreign country to receive health care, or anybody from the 1%. Where does that leave the middle class or the lower class of the country? This is sad to hear. And let me give you another example. How many people have been to the hospital whereby the hospital will be like, we cannot attend to you until you buy gloves? And you've got someone that is really sick, or maybe let's give an example of someone that has been in road traffic accident, and they are telling you this person is losing their life or losing blood, and they are telling you, you need to buy this, you need to register, or you need to buy a card before we attend to this person. This is sad to hear. Don't you think it's sad to hear? In the recent article published by Nigeria Anti-Corruption Agencies, an example is ICPC, whereby they spoke about over 60%. Or about 60% of corruption in Nigeria is funds being diverted from healthcare and infrastructures. That's where the corruption takes place. Imagine people that steal money from people that is meant for the healthcare. You could use the money to buy an MRI machine. I was seeing an article recently whereby they were talking about some states, some state lawmakers are buying cars, exotic cars and all. The amount of the car was about 10 billion naira, and I'm sure you could spend 10 billion naira in buying MRI machine, CT scan. I saw another thing about Aproko doctor talking about a state not having an MRI machine. Imagine someone with brain bleed. Someone with brain bleed that is probably having stroke or something. You're unable to get the necessary imaging to see where the bleed is at. This is sad to hear. It's really disheartening. Another example that I could give you in corruption in the healthcare in Nigeria is the in clinics in rural areas are severely underfunded. This is where you see people traveling from rural areas to major cities just to receive healthcare, and some people lose their life in the way on the journey to the place. Another issue we hear about is how the hospital does not have this drug. The drug is out of stock. Go to this pharmacy. Let me give you an example. While I was in school in UCH, University College Hospital Ibadan, you hear a lot of times that the hospital does not have drug. Go to Kunle. Then this pharmacy is a big pharmacy just outside the hospital. What's the hope of a common man? Someone that is a privately owned pharmacy can can decide to like shoot up the price. I'm not saying that's what they do, but they can decide to shoot up the price. And what's the hope of the common man if they can't afford the drugs that is necessary to save their life? The last point I want to talk about on Nigeria is the breakdown of the referral system, whereby from the primary healthcare level to the secondary healthcare level, down to the tertiary hospital. The primary healthcare level is the primary healthcare centers we all see. The healthcare center, like we almost everybody knows, whereby someone is supposed to just be able to walk in and get the minimum care that you are able to. If they are unable to attend to you, maybe is a more chronic illness that it needs to be referred, then they refer you to the government hospital, which is the secondary level of healthcare system. And after this, if the hospital is unable to attend to this due to limited numbers of specialists available at the general hospitals and some of the private hospitals, then they refer you to the tertiary hospital, which we all know as teaching hospitals. So when there's a breakdown, mostly in Nigeria, there's a breakdown, people jump from when they are sick, they don't go to primary or secondary, they jump to the tertiary. And most times, because they don't have money, when they present at the teaching hospitals, some of them, they present with hopeless case. Hopeless means there's nothing that could be done to remedy or reverse it. They just manage them palliatively. And when I talk about palliative, they're just managing the symptoms and helping the person to like hold on and keep the symptoms in check. Let's give an example of cancer. Most people could have gone to the primary care center when their cancer is at stage 1 or stage 2, when it's still really small and it's not spread. But when most people present to hospital with cancer, is at stage 4, where it cannot be reversed. I'm not saying miracles don't happen. Miracles do happen, and some people get treated and they are cured. But most of the people, when they present, their stage 4 is spread everywhere to their body. There's not enough equipment or enough drugs available at some of the teaching hospitals to tackle this. Then they need to refer them to another state or another region in the country to help them with this. And most people don't have funds to like travel that far, so most people just resolve to die at home. This is sad to see, and I hope the government is listening and they make effective change. The Federal Minister of Health put an article recently talking about how they've disbursed funds to the local government and how we should hold the local government accountable for the funds that have been disbursed. I feel like this is ridiculous, and mostly our leaders just play on our intelligence. Why were you chosen for this post? If you cannot monitor it yourself, or create an agency that monitors how the local government areas like manage the fund. I feel like this is ridiculous. What do you think? In Kenya, the Social Health Authority has lost over 11 billion Kenyan shillings. That's over tens of millions of dollars due to healthcare fraud. The money was paid to ghost hospitals, inflated hospital bills, and even services that were never rendered to patients. This is not mismanagement. This is systemic fraud. This has led to closure of over 30 private hospitals in Kenya and arrest of SHA officials. All in all, every shilling that was stolen is a shilling that could have paid for life-saving drugs, vaccines, maternal child care. This is a sad case. A major healthcare scandal rocked the nation's headline in South Africa, where a key healthcare facility was involved in a fraud uncovered by the Special Investigating Unit. Over 2 billion rands, that's over 116 million US dollars, was looted away from the hospital. This occurred through irregular tenders, procurement fraud, and syndicate activities. Several officials were arrested in this scandal. This also led to the suspension of the provincial health head amidst this massive looting. Imagine, funds that is meant to buy essential medicines, equipment, life-saving equipment, vaccines, and every other thing that is meant for everyday common man, just like me and you, has been diverted into a Lamborghini lifestyle. Imagine. This is ridiculous, isn't it? These scandals aren't isolated. They reveal a broader truth. Corruption corrodes systems, undermines trust, and makes health systems less reliant in times of crisis. Take an example of this video. This should be done in the hospital after investigation of either X-ray or CT scan. You shouldn't be reducing a fracture without knowing if the underlying vessels have been compromised. When I mean that is probably the fracture they are reducing, the person is bleeding internally, or this has affected the nerve of the person. This chronic diversion of resources increases out-of-pocket fundings, where if you go to the hospital, you have to pay for every little thing that's going on in the hospital. Limits access to essential medicines, undermines public confidence in vaccines, in clinics, and other healthcare programs, pushes healthcare professionals to quit, emigrate, or strike. This is seen in the case of Nigeria. There's huge brain drain happening in Nigeria. And also, take an example of Nigeria. Misappropriation of funds that are meant for that they could have been used for healthcare insurance that have been diverted into other things. This will reduce the number of healthcare coverage in Nigeria. Millions will go without healthcare. Kenya, ghost hospitals, fraud it into national insurance pools. This means when rape patients that needs the healthcare, they will be unable to access it. In South Africa, tenders that are illegal, procurements that are fake, that are fraudulent. This will affect the funding of hospitals when the money that should have been used to fund real hospitals, buy life-saving equipment, essential drugs have been handed to private individuals. This is disheartening. What is happening, guys? So what should we do with this knowledge? I know a lot of us have been asking. That is $1 million question. We can do without corruption. Corruption is not inevitable. What we need is transparency in budgets and procurement. There shouldn't be any budget padding and procurement fraud occurring. There should also be a whistleblower protection for healthcare workers that's come forward and talk about frauds that is currently happening in the healthcare system. Citizen oversight and watchdog organizations should be established to keep the government in check and make sure there is no fraudulent activities occurring. Public reporting of healthcare outcomes tied to spending should be encouraged, and government can go about creating agencies to help with this. Finally, accountability for those who divert public funds meant for healthcare should be challenged. So when someone steals money, the person should be tackled. Lastly, I'm going to read a statement that I wrote to drive home my point. When health money is stolen, it doesn't just hurt the balance sheet. It hurts babies who go unvaccinated, mothers who can't afford care for their child or for themselves, patients who are turned away without treatment. Imagine being sick and the hospital is saying, no, we can't take care of you. Go to another hospital, go to a private hospital, and you don't have money to afford private hospital. What is the hope of a common man? I mean, this is ridiculous. Healthcare isn't a cost. It is your right. If you found this episode helpful, please share. Talk about it, and most importantly, demand accountability from your community healthcare system, because healthcare should not be for sale. it should be available to all. Thank you.
For you and for me and the entire human race, there are